no symptoms, you still don't have any symptoms at all. What advice would you give to people out there who, want to know more about this disease?
So I would definitely say they can do research, because the more I looked into the COVID-19 and the situations and the various cases, I learned that I was asymptomatic, that I won't show any symptoms and I won't have any type of side effects, but I can spread the virus regardless. So without me knowing exactly my status, I could have been spreading the virus throughout my unit with my coworkers and everyone else.
So what would you like to say to young people like yourself who out there and who feel as if they're immune or somehow invincible to this disease?
To follow the guidelines that was put out by the health organizations and the law enforcement. Stay in if you have to, unless it is necessary to go out for more primary things. They should keep their distances, stay away, and just let the virus pass. Because from what I've learned, the more you keep your distance, is the less the virus can spread, and the easier it will be resolved.
How has it been for you being away from your unit, your friends, being by yourself?
And the family, it's been rough, but I try to make the best of it. I try to keep myself occupied. Sometimes I get up as if I'm gonna go to work. I get dressed and I operate from my computer. I would do the workouts. Try to stay active and stay positive, because after a few days you kind of feel boxed in and there's nowhere to go. But with the support from family and coworkers, they make sure that that I'm doing the right thing. I have meals when I'm supposed to have my meals. Whenever I needed something that from the outside, they made sure that they bring it to me, rather than me going out and getting a higher chance of spreading to anyone else.
Any idea from your doctors or anybody as to what's going to happen next with you?
So no ideas, because I think throughout the basis of the entire status, they're still trying to find ways in which they should, or what they should do or what they should not do. From my understanding, getting retested is not the more effective way to do, because from research it showed that the virus lives only 14 or above days. So from the time that I've been tested, maybe I had it before, to now, the virus probably already died after, and the testing period was just showing some residue of the virus. So they don't have an accurate incubation period to know exactly if when they should stop the test or get the retest done, rather than, because I have no symptoms. That's one main reason everyone is not being tested, unless you show the more than 3 or 4 symptoms. That way you're not wasting the test results on people that is not necessary.
Any piece of advice you'd like to give to your colleagues, your friends, and to your fellow Guyanese?
Yes, I should say to all Guyanese to do research, pay attention to the proper guidelines that is given out to the country, and just follow. The faster everyone follow the guidelines, the faster the virus could die and stop the spread.